Pandemic proportions, opiate addiction in the U.S., Arizona's role in the drug trade.
The United States is the world's biggest drug consumer, obviously, and the cartels will meet whatever demand that we have.
The path to recovery, the stories of drug addiction.
You would not be angry with somebody that had diabetes. You wouldn't be mad at somebody. You wouldn't stop talking to somebody if they had cancer. This person has an addiction problem. It's just a disease.
This is Arizona Week. Heroin addiction has reached new levels in the U.S. In Pima County, more than 2,000 people are being treated for addiction to opiates. Here's Dr. Len Dittmanson from Cope Community Services. What are opiates and why do humans feel this need to have them in their system?
Well, opiates have been used by humans for thousands of years. It's the milk of the poppy. It comes from the beautiful poppy flower, and it has been used by humans to relieve suffering and pain for thousands and thousands of years, mostly pain related to death and dying and the end stages of life.
How are we exposed to opiates?
Well, over the last 10 or 15 years, opiates have become a mainstay of treatment for pain management by physicians and the medical system, and the use of them has just exponentially increased over the last 10 to 15 years for the management of non-cancer, non-terminal pain, and that's the problem. Physicians
are prescribing medication. People are taking these medications and then feeling a need to continue using them?
Absolutely. The medical system was advised to use opiates to manage pain as a matter of sort of policy and procedure that came all the way from the federal government, quite frankly. And so physicians became more accustomed to using them to manage acute and chronic pain. And the problem is that they're so addicting, the opiates are, that even within 2-3 weeks of use, they take over in the most incredible way the body's need to continue taking them to avoid the withdrawal symptoms.
How would you describe that addiction, a person who may not realize that you are addicted to this?
Well, you take them because they're prescribed, and you trust your doctor and you trust the medical system to want to take care of you and never do anything to harm you. But the opiates take over for a system of hormones in our brain and our body known as endorphins. And endorphins are what make us feel well, happy, healthy, content. And as soon as the opiate takes over for that system, the only way that you can maintain that wellness feeling is to continue to take the opiates.
How big of a problem is it regionally, Arizona, and across the country?
The United States is under a pandemic of opiate addiction and dependency. 80% of all the opiates on the planet Earth are consumed in the United States. And one city after another, small towns, rural America, inner cities, we are all feeling the enormous effects of the opiate epidemic.
Who are these users? Who are these people who are addicted? Because it's no longer the idea of what you have as someone who's a user. It's someone who's been prescribed and just can't get off it. 1
degree of separation will take you to somebody that we all know who now is afflicted with this opiate addiction and dependency. It's not, there are no demographics that are outside of the reach of the opiate epidemic. Older people, seniors, middle-aged people, and unfortunately, younger and younger people are being exposed. You know, maybe they find a bottle of medication in the medicine cabinet and they try one, or they go to a party and there's a bowl of pills and they try one, and 12, 13, 14-year-olds are being exposed to opiates. Women who have children are prescribed opiates after delivery, and it's the gamut.
This is not just an urban issue. This is affecting rural America as well.
Unfortunately, rural America is really struggling with this, probably more than more than urban America because there are no treatment programs in rural America. The treatment is not available. Treatment for opiate addiction is highly regulated by the federal government, which it should be. It's complicated, it needs to be monitored and managed very effectively, and those conditions make it very difficult for clinics and providers to deliver care to rural America.
Methadone is one of the drugs used to treat addiction to opiates. Here's the story of 31-year-old Reuben Shore.
My brother was my best friend, and we were only 4 years apart. When I turned 25, I went to a tattoo artist, and my brother got a lot of tattoos from him. And afterwards, the tattoo artist said, "Hey, you know, some of these tattoos hurt. Do you want to try one of these?" It's like a Vicodin. And I've had Vicodin before when I came out of like urgent care or something. And I tried it, and it was an oxycodone, and I just felt complete euphoria. So that one pill, it turned into days where I was taking 3 or 4, and then I was snorting them, and then I was getting extended release. Then I got in a car accident. The doctor prescribed me those pills, so I was getting them free, legally. I tried getting off one day, about 2 years into it, and my legs started to shake. What I came to know was restless leg syndrome, stomach ache, and couldn't sleep. And after the second day of no sleeping, I called a doctor, you know, and said, what's going on? And he said, his exact words were, you might feel like you're going to die, but you're not going to die. Opiate withdrawal is not physically dangerous. It's mentally, you know, your mind is going to tell you all kind of crazy things because you're withdrawing. The opiates are coming out of your system, and you're going back to the old you. And then about 2 weeks later, I just felt like I needed it again. And I had a great job at the time, and I ended up, my wife divorced me. I lost my job, I lost my car, and I ended up in rehab. I got out of rehab, and the Suboxone doctor was not covered by insurance, so it's $300 every time he met. There's no way I could have come up with the $300 every 2 weeks. So I went back to taking pills, and at that time I couldn't afford them. I was living with my brother, and he was spending all the money he had. We sold everything, you know, we lost everything. And then someone we knew who in that circle said, you know, you guys are both not going to be able to pay for any more pills. You're not going to be able to get high anymore. You should just start smoking tar. I only smoked heroin for about 3 weeks, and then a year ago, September 12th, was the first day that I dosed methadone. My brother didn't want anything to do with methadone because he knew that you might get buzzed the first couple days, but then you can't get high because methadone makes your brain not crave. I haven't used opiates since I got on methadone. That's how powerful the opioid blocker. And my brother still wanted to party, you know, and he wasn't on methadone, and so that was September when I started, September, October, November, and then November 19th, I was at the clinic when it was downtown, and I got a phone call and they never give you the phone there, you know, they never say you have a call. And it was my girlfriend at the time, and she said, I have to come pick you up. And I said, what's wrong? She was clearly distraught. And she wouldn't tell me, and then when I got in the car, she told me he was in the hospital, and eventually that he had overdosed and he was dead. If I wasn't on methadone, we wouldn't be talking right now. I mean, I don't think I'd be alive. I tell Dr. Dittmanson and Armando routinely that I feel that they literally saved my life twice.
The Sober Project has existed in Tucson for nearly 20 years. It's known as Fellowship for Addicts, and its founder may surprise you.
I was born and raised in the city, Larry Munguia. I graduated from South Point High School, and I ran around with a hard crowd. We had a rough group. We did a lot of partying, a lot of drinking, and this was in the late 70s and 80s, and there was a lot of drugs. And not setting out to be a drug dealer or to do that, it just kind of fell into my lap, is that we used to, we sold cocaine. We dealt a lot of cocaine, and that's just was our lifestyle back then. It was just partying and running wild and doing what we wanted to do.
Why do it?
Why do it? The cocaine is great. It's incredible. Why drink? Why smoke pot? It's all good until it becomes a problem. That's what we always say. The only reason you do anything, especially with cocaine, when the first time you smoke, you cough. First time you take a drink, ugh. First time you do cocaine, you go, I want more. Man, and if you smoke it, forget about it. I want 10 times more. And then you start shooting it. And then you're strung out. So at my end of my gig, at the end of my day, I was working in the bars and selling dope, or working for other people selling their dope. And I traded it all away. And I lost my wife, I lost my kids, I lost my family, all that same old junkie story. It always ends up the same. The junkie loses everything. On my own, I had an opportunity to, actually my brother gave me an opportunity to go to California to a thing called the Promise Keepers. Promise Keepers was at that time was this huge movement of men, Christian men, calling other men to be godly men. And it was these big stadium events where 60 to 80,000 men would go. And I saw it on TV once, and I didn't know much about it, a bunch of men crying. But my brother says, here, go. And I uttered those immortal words, I'll try anything. Because I didn't want to quit. I didn't want to stop. I wanted my family back. I wanted my kids back. I found myself in in an apartment with 2 stuffed animals and a mattress on the ground, and I just wept because those were my daughters. And I missed them so much. And I've known my wife all my life, since we were kids. Bobby and I have been together on and off for all of our lives, since we were 13 years old. And she knew every scam and every con I ever did. So when I came back from this Promise Keepers, what happened is that in a moment, in a flash, on that Friday night, a man called out, and I gave my life to Jesus Christ. I know it sounds hokey, it sounds weird. I thought it was too. But what happened was that I had a spiritual awakening like never before. I had an out-of-body experience. I felt the presence of God. And I knew everything was going to be okay.
You were addicted to cocaine. How hard was it to remove yourself from the drug?
Well, it was easy when I was done. When I came home, it was easy. There was a couple of times when Bobby and I would go and party with our old friends and hang out, and they would like, hey, you want to do a bump, or you want to do a line? And I'm like, no, I'm cool, I'm good. I'm not drinking. I'm like, really? Like they'd heard the Jesus story. They just weren't sure about it. So they'd come around and ask questions, and I'd answer them, and they would just. So what would happen is just that we had to change friends. A lot of things that happened is we just changed. In recovery, there's 2 things you got to do. You got to change playgrounds and playmates, because the old ways aren't going to help you anymore. And just by becoming part of a church and making friends with the people in the church, that's your new circle of influence, the circle of friends.
You're working with people who are looking for a second chance.
Yeah. We empower the individuals that have, when somebody is in their addiction, there's going to be a time and a place when they want to get out of that addiction. And I always encourage the family members or the loved ones to be ready, to have the information, have the phone number to the detox, have the number to the halfway houses, have my number. These are the things that are right there and ready to go. So as soon as we find out, or there's just a slight hesitant, and this person is ready to seek some recovery, jump on it right away. Give me a call, we go to work.
There are people who don't want to give someone a second chance, that maybe judge them based on appearance, and they question, have you really got it back together?
Yeah, you gotta where you're coming from. Where are you coming from? Are you coming from a place of pain and hurt? Maybe these people hurt you in the past, you know. You would not be angry with somebody that had diabetes. You wouldn't be mad at somebody. You wouldn't stop talking to somebody if they had cancer. This person has an addiction problem. It's just a disease, just like anything else. Unfortunately, the disease can affect us sometimes. But remember, man, these are people, human beings, that all they want is a second chance or a third chance or a fourth chance.
Do we run a risk of ignoring these people, ignoring these children, and then letting the problem just fester?
I'm sure. If nobody steps in, nothing's going to change. They want someone to step in. They need someone to step in. That's where I'm here. I step in. And our church steps in. Our church, they go to other meetings. They go to AA meetings and NA meetings, and they go and say, there's a place you could come to seek God on your own level, at your own place. My responsibility and the responsibility of the leaders of this church is to help you and you develop your own personal relationship with God. It's not about religion. It's not about corporately thinking the same way. This is about how God speaks to you through the Word and to have somebody help you guide through that process. That's what we're here for.
You've been clean almost 20 years. You were an addict. Who are you now?
I'm a Jesus-loving, Bible-thumping, born-again believer in Jesus Christ, and a father of two incredible young adults, and the husband of the most incredible woman you'll ever know, and a leader of a church that's changing the world. That's me.
It's estimated more than 7,000 kids in the U.S. start using drugs every day, and the Drug Enforcement Administration works to take narcotics off the streets. Well, Doug Coleman, you're the special agent in charge of Drug Enforcement Administration in Arizona. Thanks for having us here.
Well, thanks for having me.
Where are we?
So here we are in what we call a secure facility that stores drug evidence that we seize here in the state of Arizona. As you can see around you, most of this is marijuana. We'll seize anywhere from 1.5 million to 2 million pounds of marijuana per year in Arizona. It all comes here, it's all processed and ultimately destroyed from this facility.
Marijuana, it continues to be the big product that's coming across the border, but now you're seeing heroin as well.
Yeah, we see a lot of heroin. Our heroin seizures have increased over 200% in the last 3 or 4 years. A lot of heroin coming in, all directly related to a increase in heroin addiction in the United States.
Heroin, is it produced, manufactured in Mexico, then brought over here?
Yeah, most of the stuff that we see is manufactured in Mexico. We used to see some stuff coming from South America, but for the most part, the Mexican cartels have started manufacturing on their own, and then they're moving it in through Arizona's border.
So heroin is an opiate, and it's my understanding that people are connected to prescription medication, and they find heroin. How easy is it to find it in Arizona?
Well, so here's the issue. Prescription drug abuse, nobody starts out wanting to be a heroin addict, right? But they will start out getting addicted to these prescription drugs. So what's happened is our prescription drug epidemic has increased because we get a lot of kids that are getting hooked on these opioid-based prescription drugs. As that's increased, the Mexican cartels realize, hey, there is a void that we can fill here. The prescription drugs will sometimes get up to $60, $70, $80 a pill. If the Mexicans flood the market with heroin, they can drop those prices all the way down to $10, $15, $20 a bag, and the kids will then switch, or your opioid addicts, even if they're young adults, they'll switch down to the heroin because it's a lot cheaper than the pills are.
It's not just in urban communities, it's now in rural America as well.
Yeah, because you know what's happened is as people get the prescription drugs, those are clean, right? The stigma of having to inject heroin that used to be around, it's not here anymore because they're getting hooked on these opioids from the prescription. It's a pill. A doctor gave it to mom and dad because mom and dad had surgery. Mom and dad left 15 of the tablets in the medicine cabinet, so I grabbed a couple of them. And like I said, these kids don't plan on becoming heroin addicts, but they start off with those pills. Opiates are very powerfully addicting substances, and what ends up happening is they go down a path that they can't stop.
And it's cheaper and easier than getting a prescription.
Well, the prescription, what happens is because the prescription drug is cleaner, people will then divert that and they'll charge a lot more per pill. So when you get the prescription drug from a legitimate prescription, it's relatively inexpensive. But then if you sell it on the street, they're going to jack the price up.
Methamphetamine used to be bad. Is this worse? Are they the same?
You know, I think they're different types of things. Methamphetamine is still a major problem. It's still a we seize a lot of methamphetamine here too. Methamphetamine is coming in increasing numbers as well, because cocaine has shifted a little bit outside of the United States, and it's going through West Africa into Europe. Reason for that is, here in the United States, and especially on the southwest border, the Mexican cartels control the drug trade. So what's happened is they can manufacture their own methamphetamine, whereas they can't manufacture their own coke. They have to get it from South America, and then they just pay a transportation fee to get it through Mexico. Well, the Mexican cartels have increased that stimulant, which is methamphetamine, to take the place of coke coming over here. And the cartels down in South America, they realize they're losing business on the American market coke-wise, so they're shipping it over to Europe.
DEA recently had a prescription take-back. How does that play into factor into this addiction you're talking about?
So when people think about DEA, they only think about the cops, right? They think about the agents like me that go out and arrest the drug dealers. But we have a whole other side that regulates the legitimate drug industry. In the United States, if you want to write a prescription for a controlled substance, that's regulated by DEA. Now, we don't regulate the practice of medicine, right? So we don't regulate the doctors. That's done by the states. But we regulate their ability to write a prescription for a controlled substance. Opiates, prescription opiates, OxyContin, oxycodone, hydromorphone, the things that these people are getting addicted to, those are all controlled substances. So we have an entire regulatory side that regulates the doctors that write these prescriptions. Now, we have, what's feeding a lot of this is some bad prescription writing. And what's ended up happening is that doctors, in the old days, doctors did not write very many prescriptions for opiate-based controlled substances because they're very powerful painkillers. And so they found other ways to try to control people's pain besides that. What's happened now is people want their pain relieved immediately. The fastest way to do that is to write an opiate-based prescription. So the opiate-based prescriptions that are being written by doctors, and 99.9% of them are completely legitimate, but the numbers have increased. And with that increase in the number of those, the actual market and the actual amount of opiate-based prescription drugs that are getting out on the market has increased dramatically.
For a long time, we heard that Tucson and Phoenix were central hubs of this drug trade. Is it still true?
Yeah, everything comes into Phoenix or Tucson first. Sinaloa cartel predominantly operates in this area. They use Arizona as a transshipment point. So we get large loads of drugs that come into either Phoenix or Tucson, and then they're redistributed throughout the United States from stash locations in those two cities.
There's a lot of contraband in here. I mean, are you guys making a dent in the process?
Anytime that we can take stuff like this off the street, we're making a dent. People say all the time, well, you're not getting anywhere near what's coming in. Is that what's important, or is the fact that all of this is now going to get destroyed and it's not going to go into the hands of American citizens? All the heroin that we seize, the thousands of pounds of heroin, every time we seize that, potentially there's some kid that's not going to overdose from that load of heroin. That's what matters. That's what matters. Everything that we do makes a difference.
There are ongoing efforts to combat addiction. The DEA recently held a prescription drug take-back event and collected more than 6 tons of prescription medication. By early next year, there will be 3 new treatment services run by Cope Community Services. Here again is Dr. Len Dittmanson. What happens next? Where do we go from here?
Well, the unfortunate reality is that it's very hard to treat opiate addiction with abstinence only. People cannot just stop taking opiates much of the time. So that means that we have to use medications to treat the addiction. Methadone, buprenorphine, naltrexone, those are the tools that we use to just stabilize the addiction in the short term, and hopefully add things to the treatment to resurrect the endorphins and to get them back into health and wellness.
Tools, but they are drugs used to treat a drug.
They are, and they have their own addictive issues that are real, but at least it becomes more manageable for people to take medications that can control it. It's like taking insulin for diabetes. I mean, you have to take something that stabilizes the underlying pathology and then work towards a wellness reconstruction of the endorphin system in the brain that will allow them hopefully to get off the medications in the future and restore their wellness without using the medications.
The person who is on these medications and then just stops taking them because they're suddenly feeling better, they may have some effects to their body they may not realize are because of this removal of the drug?
Absolutely. People, when they first go into the opiate withdrawal state, they don't know what's happened. They think they might have the flu or some other affliction, some other condition, and it's so bad and it's so terrible that they might want to go to the hospital, to the emergency room. What's wrong with me? I have the chills, I'm shaking, I'm sick, every bone in my body aches, every hair on my body hurts. So they go to the hospital and they're administered another opiate, probably in the emergency department, and all their symptoms go away. And then the link is made. That sickness that I'm feeling is related to lack of taking the opiate.
Doctors are part of the problem.
Yes, unfortunately, the medical community does not yet, I think, understand or grasp the enormity of this problem. And opiates are still being developed. More and more powerful opiates are being developed by pharmaceutical companies, and there are good uses for it. If people are struggling with cancer pain or chronic debilitating arthritic symptoms, they need opiates to control the pain. But they need to be used wisely and carefully and managed and understood for the dangerous side of opiate use for management of pain.
So why don't doctors just quit prescribing these medications, or so many?
As a matter of fact, it's happening that doctors are being advised to reduce the amount of opiate pain medications that they're prescribing, to shorten the course of treatment for an acute pain syndrome, to be very wary of the dosing that they administer for pain management. Those things are happening very quickly. The problem is that so many people are now addicted that black tar heroin becomes the only alternative available for people to manage their opiate dependency and addiction.
Here at COPE, you see patients who want help, who get on a treatment program to get that help. Do you often see success stories?
Oh yes, every day. Wonderful success stories. People that get their lives back, their jobs back, they can take care of their children, they're having children, their relationships with their family members reemerge. Every day we see this.
And that's our program. For all of us at Arizona Public Media, I'm Lorraine Rivetta.